So, you're a general practitioner and you've got your sights set on a career in Dubai. Fantastic. But before you can get there, there's one major hurdle you've got to clear first. In this explainer, we're going to give you the complete roadmap to absolutely conquer the DHA Prometric Exam, from the nitty-gritty of who's eligible all the way to your final exam day strategy.
You've put in the work, right? All those years of training, all that invaluable clinical experience. Now you're ready for that next big move. And Dubai is an incredible goal, but to make it happen, you first need to pass a very important checkpoint.
Think of this exam as the gatekeeper. It's the official assessment from the Dubai Health Authority, and it's designed to make sure every single doctor meets the high standards they expect. Passing this is totally non-negotiable, and our goal today is to hand you the key to unlock that gate. Okay, let's dive right in. Before you can even think about building a study plan, you have to really understand the challenge in front of you. So in this first section, we're going to break down exactly what the DHA GP exam is, who can take it, and what the whole thing actually looks like. The most important thing to know right off the bat is that this is not some obscure academic test. No way. It's a super practical assessment of your core skills as a GP. The Dubai Health Authority and Prometric have built an exam that's all about the reality of the job, managing the everyday outpatient cases, the emergencies, and the chronic care problems you'd actually see in a busy Dubai clinic. So, who's actually eligible to take this exam? Well, you'll need your medical degree, of course, a completed internship, and at least 2 years of clinical experience after your internship. On top of that, you'll need a valid license and a good standing certificate from wherever you're practicing now. And here's a crucial tip. These rules can sometimes get updated, so always check the official DHA guide. It's called the Professional Qualification Requirements, or PQR, for the absolute latest info. Let's take a quick look at the exam format. It's a computer-based test. You're looking at about 150 multiple-choice questions, and you've got roughly 3 hours to get through it all. But look, check out that last line, no negative marking. This is a huge strategic advantage. It means you should never, ever leave a question blank. Even a wild guess gives you a shot at a point. So what's the magic number? What's the target you need to hit? Well, the pass mark is typically right around 60%. This is so key. It's not about getting a perfect score. It's about proving you are a competent, safe doctor. Knowing this number transforms the exam from this intimidating monster into a clear, achievable goal. You just need to get a little more than half the questions right. You can do that. All right, we understand the challenge. Now let's build the plan to beat it. This next section is your treasure map. It's going to show you exactly where to focus your study time for the biggest possible impact. Pay close attention to this chart, because this is your key to studying smart, not just hard. Internal medicine and emergency care, that alone makes up nearly half of the entire exam. Then you add in pediatrics and women's health, and you're looking at a staggering 80% of all the questions. The message could not be clearer. If you master these areas, you are well on your way to passing this. And if we drill down a little further, these are the high-yield topics. We are talking about the absolute bread and butter of being a great GP. Managing chronic stuff like diabetes and hypertension, handling acute problems, recognizing those red flag emergencies, and of course, knowing your essential pediatrics and women's health. This right here, this is your core study checklist. Okay, so you've got your study topics lined up. Now let's tackle the logistics, the paperwork. This next section is all about taking the mystery out of the application process. We're going to break it down into a simple, step-by-step path to get you to exam day without any of the stress. You know, the application process can seem a little intimidating, but really it's just a sequence of steps. You'll start on the DHA's Sheryan portal, upload your documents, and then you'll kick off the primary source verification with a service called DataFlow. A little pro tip here, start that DataFlow process as early as you can, because it can sometimes take a few weeks to complete. Once that's all approved, you'll get your eligibility and you can finally book your exam with Prometric. Now here's a study timeline that we've seen work time and time again. For the first 3 weeks, you're building your foundation. Go deep on internal and emergency medicine. This creates a really strong core. Then, for the next month, you broaden your scope to cover all the other topics. But those final weeks, they are the most critical. You stop learning new material and focus completely on revision and doing full-length mock exams. This builds the mental stamina you are absolutely going to need on test day. And here is probably the single most important strategy to make that whole plan work. Just passively reading your notes, it's not enough. The key, the real secret sauce, is combining your knowledge with active practice from a question bank, a QBank, that's specifically designed for the DHA exam. Answering questions forces your brain to actively recall information, which is way more effective for learning, and it gets you totally familiar with the style of the real thing. We are on the home stretch. You've done the prep, you've navigated the application maze. This final section is all about execution, how to walk into that exam with confidence, and how to avoid the common mistakes that trip so many people up. Let's talk real exam strategy for a second. The candidates who succeed, they focus their energy on those common, bread-and-butter GP topics, not some super rare disease they saw once in a textbook. They practice with timed question blocks to get used to the pressure, instead of just passively reading notes. And above all, they master emergency medicine, because it is a huge part of the test and, let's be honest, real-world patient safety. In that final week, use this checklist to just calm your nerves. Confirm all your booking details. Make absolutely sure you've completed at least 2 or 3 full mock exams. Do one last quick review of those critical red flag topics. And please don't forget the simple stuff, like planning how you're going to get to the test center. The whole goal here is to eliminate every bit of logistical stress so you can be 100% focused on the exam itself. And really, that's what this is all about. By understanding the exam, by following a solid plan, and by practicing the right way, you take back control. You turn this big, scary hurdle from a source of anxiety into a predictable challenge that you are totally equipped to handle. You've already earned the knowledge, you now have the plan, so go out there and confidently open that door to your new career as a GP in Dubai. You've got this.